Hello everybody, here we are again. Sorry about last week, we've had a week off, we had a busy meeting, so hopefully you've got lots of questions for us this week. We're the infant feeding team at the John Radcliffe Hospital in Oxford, and we are Alex and Naomi, the infant
I'm just going to move the baby because it looks
midwives.
like it's doing a dive off the back.
Got our babies with us. And this session is for infant feeding only, so questions and answers for about an hour. We do it on a regular basis. We're well into our second year doing this now, and it's you that makes the questions up and we answer. So it's anything that you want to talk about that's got to do with making milk or anything at all. Breastfeeding,
Early days, stopping
late
feeding.
days, absolutely, mixed feeding, pumping, and anything that goes alongside that. What we're not is for things like scans and appointments and visiting times and that sort of thing, which have changed over the years with COVID, but hopefully they're pretty stable now. So we're not getting quite so many questions about that, but or labour or early labour and visiting in labour and that sort of thing. We are midwives, but we don't always know the right answer. So there are other forums for that, and I think they had asked the matrons on Monday, which is the perfect forum for that.
It was
sort of
Meet the
question.
Midwife on Monday,
Oh,
and
it?
then it was Ask the Matrons the week before.
Yeah.
So I think they take it in turns. They've done inpatient services as well. That was a few weeks ago.
So there's lots of questions to
yeah.
ask about policies and guidelines and things like that you need to know. But also remember that you can ask your own midwife as well. So you should have a number to call your midwife if you've got any worries, and you can ask those questions as well when you have your appointments if you're not sure about, if it's not an urgent question. So hopefully you're going to have lots of brilliant questions for us again, and tell us your stories and let us know where you're from, because we don't know where you're all from. You just put up these questions and we don't know if you're Oxford or whether you're from further afield. Sometimes we see that it looks like some women are much further afield, but we don't know. So anything at all, anything too silly, never too silly. So do please ask us, that's absolutely fine. And I think we've had a bit of are we allowed to say the word quiet? Quite a week, haven't we? It's been a bit,
our phone's
better on the wards.
Our phone's not run quite so much, that's for certain.
I haven't got my bleep on me now, but
we've left the bleep behind on purpose.
It always goes off when we're on air. So so hopefully you're busy thinking about the questions for us and telling us how you've got on from the last sessions we've had. Has it made a difference? Because that's always really helpful as well. One of the things we thought we'd talk about today was just generally
sorry, that's me. The screen coming up.
weaning off breastfeeding, because some people are going back to work, or they want to stop for medications, or for whatever reason. So we just thought we'd talk a little bit about how you would do that, because if you're wanting to stop breastfeeding for one reason or another, you're wanting to stop some of the breastfeeds, you can't really, we don't recommend that you do it all of a sudden. And you might find that you've got a relative that might say to you, oh, I was told to take Epsom salts, and you just had a big dose of Epsom salts and you got really dehydrated and had a terrible stomach for 24 hours.
That definitely predates my training.
Well, that's because I've been here for 42 years nearly. So.
I've never heard it.
So if you've got an aunt or a granny or a mum that says that to you, that's not what we recommend. So you will find yourself in great trouble if you suddenly stop breastfeeding and you've been exclusively feeding, because your breast will get very full and the risk of getting mastitis is really high. So the question is, how do you do it? How quickly do you have to do it? And it might be that you've got to go into hospital, or you're going away, you've got to go on business. Somebody said to me they're getting married and they wanted to be able to introduce bottles. So lots of different reasons. And it's a very slow process.
And I'm just going to say, we do quite often get asked about mothers who are going into hospital, and actually we need to have a discussion about that. We do, ideally you should be accommodated as best you can, and that isn't a reason to stop feeding. So
no, we've got the service, the hospital trust, and the chief executive has committed to supporting us in our quest to get baby friendly, and we're almost there. We're just coming to the end of our planned assessments that we've done, which means that we support all mothers, however, whether they're employers or whether they're patients, or whether their mum's having babies or whatever, to support breastfeeding people. And so they're committed to that. They signed an agreement to say that they would support us. So that means that anywhere you go in this hospital, you should be supported to give breast milk and to get help to breastfeed, and they should be able to direct you to the right place. So we do get lots of calls, don't we?
We do, yes. I've got one at the moment I'm dealing with, so I'm just going to have a chat with the mother about how long she's likely to be in for, what plan we can put in place for her, and if you were admitted to hospital all of a sudden, then they should be able to organise a pump. We have a pump that's specifically for other parts of the hospital, so sometimes we have mothers who are admitted and that we sort of pump out for them. So,
and I think A&E has its own pump actually. Yeah. So if you're going into A&E and you need to pump because your baby's not well, or you've come in and left your baby at home, for instance, because you're not well, then you should be able to have access to a breast pump, and they should be able to support you to breastfeed. And if that's not happening, then you need to make sure that they do ring the right person to get it. And actually, out of hours, when we're not around, they can ring the wards, the bleep holders in the wards to get that help.
Maternity bleep holder would be who they would go to. We've got loads of questions flying in at the moment, so I wonder if we just do some questions.
Yeah, and then we can come back to how to wean, because some of the questions might be part of it. So we can.
Well, the first one's the opposite. So the first one's from Hannah. She was quick off the mark, so she's got her question in first.
Brilliant.
So when's the earliest you can try expressing and collecting in pregnancy, ready for the little one? So we often say that you can have a go at 36, but don't make a point of collecting it. You just have a practice, but 37 weeks onwards. Yeah. There's a minute risk you might go into labour. We don't want any babies born before they need to be. There are risk factors with babies being born a little bit early. So 37 weeks. Have a look on our webpage. So if you go onto the website, and I say this most weeks, if you do a search on Google, OUH maternity feeding, our webpage will come up, and you can see a leaflet that we've got up there called Collecting Colostrum While You're Pregnant. And also there's a link to a series of 7 videos, and there's one that shows hand expressing, so you can have a look at that. So that'll get you sorted out, and have a chat with your community midwife about getting some syringes. And the final thing is something we've been discussing a lot this week, is keeping your milk safe. So what we have is a bit of an issue when you come into the hospital, is access to freezer space. So if you are coming in and you have hand expressed colostrum already, bring the barest minimum in, please. Bring it in a cool box with lots and lots of ice blocks so it stays frozen, because we do not have much in the way of freezers. We're hoping to rectify that, but we do have a problem with that. The other thing that we have a problem with is keeping it with you. So sometimes it may go into one freezer or one fridge, and then it doesn't follow you around the hospital, because you come in, you go to MAU, you may go to delivery suite, you might go to observation area after that, and then up to level 5. Well, that's 4 moves. So in that process, sometimes milk goes missing. So ideally, as little as possible, in a cool box with lots and lots of ice blocks to keep it frozen, and that would be the best bet, and keep it with you if you can.
Don't open it when you come in. Just
keep it frozen.
Closed.
Yeah,
don't
keep it
closed. Don't open any of the
closed.
boxes when you come in, or any of the bags. Just keep it closed until you need it, because you don't know how long your labour's going to be.
Especially if you're coming in for an induction, that can last quite a long time.
You might get delayed and all the other things. So if you think it's going to be delayed, get your partner to take it home again and put it back in the freezer until you're ready to come, because you just don't want to waste it. And the other thing is, when you do hand expressing, and we talk about it may start you in labour, what you might find is that you get some Braxton Hicks as well. So you might find that you get a little bit of uterine activity when you start doing the stimulation, because you're releasing oxytocin, which is the hormone that creates labour as well. So that's why we say don't do it before 37 weeks, because actually if you go into labour at 37 weeks, probably you're ready to go into labour if you start labour when you're hand expressing. If that tips you over into labour, it's probably because you were going to go into labour anyway, but you might find that you've got a little bit more activity in your tummy. So if you find that you're really irritable with it, then pull back a little bit, if you're worried about that. So, but try it and see, because some people don't even notice that. So you don't have to experience any of that, but you might, and that's why you don't do it before 37 weeks. But it's likely that you'd be going into labour probably within that 24 hours if you start getting really regular tightenings and it starts to stimulate you. It probably was because you were going to do it anyway.
Yeah. I help you along.
Yeah. tips you the right way.
Charlotte is back from her holidays.
Oh, I hope you had a lovely time and the sun shone on you.
With Alicia, she says that she's hopes we're keeping well and keeping safe. She's back from her holidays. She missed last week. You didn't miss anything, so we had to cancel last week because we had a meeting we had to go to, so don't worry. And she said Alicia slept both flights, and that was good because that's always a worry, isn't it? And
they all loved you.
And she walked a long way, but they thought she was an angel. So, well done, nice for you two.
It's an exciting day for them, isn't it?
Rachel has come on. We know Rachel. She says, I'm in Headington, not far at all. Wondering about complementary foods and weaning. She says, I have a 12-week-old, but maybe there's a bit of pressure sometimes to wean earlier these days. Wondered what your thoughts are. Poppy's been exclusively breastfed so far. Well, actually, I think there was an awful lot more pressure to wean a lot earlier before, because both of us were
wrapped with guilt about that.
We were expected to wean at 3 to 4 months.
12 weeks we started ours on.
Nowadays, it's definitely recommended. Hold off. Your baby does not need anything else other than your breast milk until 6 months, Rachel. Keep going. You might find that your baby starts to wake up a little bit more on occasions as you get closer and closer to the 6 months. Pop another feed in. Follow your baby. Let them tell you what they want. Your milk is constantly changing to meet your baby's needs. They do not need anything else before 6 months. And if you give them anything else, then actually what you're doing is displacing milk, and they haven't got the capacity to break down other foods. So, for instance, amylase is the enzyme that breaks down starch. And Naomi and I would have been giving our babies baby rice from 3 months old because that's what we were told to do. And it looked like wallpaper paste, and it was horrible, and it went in and out and in and out. And actually all it did was fill them and did them no good because
that's not ready to have it.
They didn't have any amylase in their gut, and they need amylase to break down starch. So amylase only appears at 6 months. So hold off, keep going. And I can see Charlotte's just popped up. Food before 1 is just for fun. Absolutely, she's got it sorted. That's what we always say.
What you might find is that your baby has a bit of a spurt at 12 weeks and starts waking up all night, every night for about a week.
Yeah.
And that might be where you are at the moment, where your baby's just suddenly gone from sleeping quite well to waking up and breastfeeding a lot. And that's them just saying, this is where I am now. I'm 12 weeks and I need the next level of breast milk, please.
Yeah.
And they're starting to change the components of your breast milk. So the different things in your milk production goes to the different fats, different enzymes, different elements of the composition of your breast milk changes, and the fats and things, so that they're ready for the next level of development, which they start picking things up, they start putting things in their mouths, they start to explore outside of you, and they are protecting themselves from bacteria, and so them getting lots of different composition of breast milk plus getting your antibodies is protecting them from their next stage in life, which is 3 to 6 months. And they do an awful lot between 3 and 6 months. I think 0 to 12 weeks they don't do anything terribly different. They don't move very much, and they smile and they laugh and things, but they don't start moving around like they do from 12 weeks. So they're ready for the next level, but it's not the level of food, it's a level of learning, and but they need to feed more to step up on that one. So the first bit of feeding that you do when they're born, where you're calibrating, and when they have that mad feeding frenzy in the first 3 days, and they're chomping for milk, and your milk hasn't come in, and they spend 24 hours just feeding solidly before your milk comes in, and you think you haven't got enough milk and you can't do this, and you're feeling a bit tender on your nipples and things like that. Which is why we talk about getting your positioning right, so your baby can do that when they're chasing the milk. That's the calibration for the first 12 weeks, and that determines your milk production up to 12 weeks, that early days breastfeeding. So it says, this is what I'm going to need as your baby, so not your friend's baby or anybody else's baby. It's what your baby is telling you it needs to have as a baby up to 12 weeks. So if you introduce other foods in that time, it changes the calibration slightly in your milk production. And so you get to 12 weeks, your baby does that again. That's your feeding frenzy for a few days. You go to bed for a week, just as you think you've got your life back, they start asking for more, and then they settle down again, and then they just go through till they're about six months old. So that's where you are at the moment, is you're in that next phase where they're asking to calibrate the next level of milk production, and they're calibrating it.
Some people would describe it as growth spurt. That's what we used to be here at our, so we have this
But it's
little
quite
period
normal
of
for your
time.
baby to start waking up
Yeah.
at about 12 weeks, between 10 and 13 weeks, but it's usually around about 12, and they just feed all the time for, every night, all night they're awake again, and you think, oh blimey, what are we doing wrong?
Nothing.
But actually they're calibrating.
Nothing.
They're saying, this is what I need for my next phase.
So I think, Rachel, you've got to 12 weeks exclusively breastfed.
Yeah.
Keep going.
Yeah.
Keep going. We know the best health outcomes are for babies that are exclusively breastfed for the first 6 weeks, and then they're fed, as Charlotte's already said, then other foods get introduced, but actually breast milk is still the main source of nutrition.
Breastfeed first.
All the way up to a year. So keep going. You're doing an absolutely brilliant job. If you've met your baby's needs to this stage, you will continue to meet your baby's needs. There is no concern about your supply. Your baby will get what they need, and they will drive your supply.
And actually the volume doesn't change
No.
between 6 weeks and 6 months. If they get about the same amount, it's just the composition keeps changing, so the fats and everything else changes.
Because your breasts are very clever.
Yeah.
So
Yeah, they're unique to you
yeah.
and your baby.
All the best, Rachel. And obviously, any concerns, you can get in touch. But keep going. You've done a fab
Be
job,
confident.
and inspiration to everybody else who's watching, who maybe isn't quite as far as you are, and you can show that it can be done. It's fantastic. Shakaya has said, I have 2 small keloids on either side of both nipples. Will I still be able to breastfeed as they're quite painful? I think you'd have to be careful with positioning attachment. What do you think?
How are you breastfeeding, or are you pregnant?
Well, I'm guessing that if she's will she be able to breastfeed? So
You're pregnant.
I think Shakaya is pregnant.
Yeah, so it may be that you need to talk to your midwife or your GP about the scars and let them have a little look at them, whether they can give you something to make them a bit softer before you get to breastfeeding, just see how it goes. It may be that your breasts are tender rather than the scar, and your breasts are quite often tender in pregnancy anyway. Is that the case? Make sure you get lots of help when you've had your baby. I think that's really important, so that you can get the attachment to see, because actually if it's just on each side of your nipples, the baby may just have that in the mouth, and the breastfeeding is the bit that's past them, and it may be that it doesn't involve the keloid scar.
You could do it with this, couldn't you? Because if you imagine when a baby goes on the breast, if you think about a nipple here, then actually they take a lovely big mouthful and then take the breast to the back of the mouth. So actually it's quite possible that there won't be any pressure on that area, but it depends very much where they are and how they feel.
Yeah, because if you see that picture, it's not equal. The baby doesn't go in the middle. It's very asymmetrical. So the chin is much lower there, and so it may be that their mouth goes underneath where the scarring is, and then it doesn't move in the mouth once the baby's on properly.
And then thinking about the fact that actually you could plan how you put your baby on the breast. So if you've got them in a particular place, a baby can feed at any point on a breast, so it doesn't matter. So we talk about, we can feed babies anywhere because the breast is round. So, I'm sure that we can come up with a plan that will help you to minimise any discomfort. So I think have a chat with your midwife, and if need be, you can have a conversation with us before you have your baby, and we can put a plan in place for you. So I hope that helps, Shakaya.
Get help.
Yes, definitely.
Contact us if you need to. We can see you on the ward if we need to, just to see what's happening if it's appropriate.
Ty has another comment. She says, hi, I've been colostrum harvesting. I'm currently 39 plus 5. I've managed to collect quite a few syringes. The question is, I have now is how many should I bring with me when it's time to come in, or should I just bring the ones I have and come home with any I have left over? So I think we were just saying bring as few in as possible. If you've got some recently harvested ones, so let's say you've got some in the freezer, and bear in mind it can stay in the fridge for 5 days. The ones that you want to bring in are the ones that are just refrigerated, because they last longer. Once you've frozen your colostrum, it needs to be used within 12 hours for removal from the freezer. So as soon as it's defrosted, we should be using it, and we think that it can take up to 12 hours to defrost. So from that point of view, if you've got any that's freshly expressed, bring it in a cool bag with ice blocks and keep it as cool as possible, and leave any surplus at home. You wouldn't need to bring in very much. I don't know how much you've got. You've said quite a few.
You can bring milk in. You can bring a colostrum in when you've had your baby as well. Yeah. Remember, if you're staying in for more than one night, they can bring extra if necessary. But also you can express while you're in labour.
Yeah.
And that will help labour as well. If you're just niggling a little bit, or you're waiting to start labour, if you're being induced, or if you've got gaps between, and you're in early labour, then use that opportunity to hand express, because that's all right for 24 hours then. So you can use that for 24 hours, and it may tip you into good labour. So.
And the thing to remember, because we've talked about, we always do talk a lot about hand expressing antenatally, is to remember that when you do give any antenatally expressed colostrum to your baby, you need to be expressing at the same time, because your body doesn't know that you've given that antenatally expressed colostrum. Once you've had your baby is how you establish your milk supply. Everything you do before has no impact. Once you've had your baby, if you're giving anything other, and it can be even your own milk, your colostrum, your body doesn't know that. It's the stimulation, the frequent and effective stimulation of the breast from birth onwards that makes the biggest difference to your milk supply.
It's removal of the placenta that stimulates the hormones to change. And so if you have still got a placenta in, that's not going to make milk. It's not going to tell your body to make milk. So as long as you've got your placenta, you're not going to make milk. So it's only when your placenta has come out does the hormone level change, and then you do lots of stimulations from in that first hour onwards, that you then start to put the order in for making milk in 48 hours plus.
So I think the answer to your question, Tara, is bring in a minimum amount. Let's say you had 5 syringes you've done, bring 1, leave 4 at home. If you've got one that has been recently expressed and it's so fresh colostrum, then bring that in preference to frozen ones, because if they don't get used and they defrost, we have to throw them away. So that's so sad. So have a think about that. All right, wishing you luck. We are trying to work on it. We're trying to see what we can do about making sure we have a better system.
Transition. Through the hospital.
We're toying with ideas how we can make it work, and that will work with staffing levels as well, in making sure that we can get that milk to follow mothers around.
It does go walkabout sometimes, and that's really upsetting when you've worked really hard to collect it. So because you move from area to area, sometimes it's left behind unintentionally, and then people can't see you on the board because they've come on the next day, and they think you've gone home and it's been left. So they don't follow it through and have time to find out where you've gone.
So we're working on that. That's a work in progress. So yeah, I think minimal amounts. So Claire has messaged, and I'm really sad because I'm really delighted for her. She's had number 2. She said, "Hi both, just to say hello and update that I gave birth to baby number 2 on Sunday. We saw Tamara from your team on Monday, and of course I wasn't working Monday. No. I'd have loved to have seen you, who confirmed a very anterior tongue tie as we anticipated. She's actually feeding well. I was also able to donate over 300 mils of antenatally harvested colostrum to Amanda at the milk bank. We'll continue to donate our mature milk now. Thanks for all your support." Oh, Claire, I knew you were donating, and I knew you were expecting number 2, and I'm gutted we missed you. So I'd have loved to have seen you and to congratulate you, and see pictures of number 1, because I'm sure number 1's very different now. So well done you, that's fantastic. And thank you for all the donations that you've made.
Huge contribution.
I think really good time to say that actually when OMVP put out, and Oxfordshire Breastfeeding Support put out, that the milk bank was on amber and we were looking for new donors, and Amanda had 70 people connect with her about it. So that's absolutely amazing. So so hopefully we won't be on amber for very long. Obviously it all has to be processed and checked, so it takes a bit of time, but thank you so much to all of you that donate. It's truly wonderful.
Gift from women for women.
Anybody who's thinking about donating or wants to know a bit more about it, have a look back a few weeks ago, because we did Facebook Live from the milk bank with Amanda and covered all the questions that anybody had at that point in time, talked about the process, talked about what's happening, talked about who gets donated as well, and so so we talked about that. So that would, all questions would be answered on that one. So, but congratulations, Claire, that's fabulous news.
Hope birth was all right.
Yeah. Shakai has come back. Also, on the other day, I woke up to what appeared to be dry milk, but haven't had any since. Is this normal? I'm currently 33 plus 3.
Yep. You start making colostrum from about 16 weeks, and so some mums leak all the time, and from 16 weeks onwards, and some mums don't see a drop until they start hand expressing or when they've had their baby.
Yeah.
So both of those are normal. And so yes, it's absolutely normal, absolutely. And you may not see it again, you might, and it might be on one side and not the other. It doesn't mean anything. It's just sometimes people leak in the night when they're asleep, but not everybody does.
Sometimes it can look like you've got like some crystalline sugar on, doesn't it?
Yeah.
So it goes dried sugar.
Quite crunchy.
Yeah, quite interesting. I spoke to a mother today in clinic and she said, everything's sticky. I said, yes, because breast milk is full of sugar. And it needs to be full of sugar because it's growing our baby's brains, because that's what is so important about our milk. That's where our milk differs tremendously from other mammals' milk, because our babies need lots of sugar for their brains because we're growing babies' brains. So, so yes, human milk is very, very sweet and sugary. So that's for a reason. Hannah has come back and said thank you for our answer to her. Charlotte, I already said, it came up saying food before one is just for fun. Rachel's come back. I love you ladies, always so encouraging and reassuring. It's so easy to think you need to do this and that based on all the things people can say. Then I come here and your words always make so much more sense. Also fascinating. There is some great resources out there. Another person, and we were chatting about this person earlier, is Emma Pickett. Emma, if you want to follow somebody who talks a lot of sense, she comes from Association of Breastfeeding Mothers background. She's just done a talk on a forum that we are both part of for our lactation consultants, but you can follow her on Instagram. She's been doing lots recently about stopping feeding, so a bit like we were chatting about earlier, there's been a lot about that, and what she called natural term breastfeeding, i.e. feeding to when you want to stop and when your baby wants to stop. So someone like that has a lot of good information out there too, very evidence-based.
And it's the right information.
Yeah, absolutely.
Really
So we would definitely think on the same line to someone like Emma Pickett if you wanted to have a look at someone else. So I follow her because I think she's very interesting.
There's not that many rules in breastfeeding, but so we do end up saying the same thing over and over and over again, and you might have noticed that if you've watched our sessions for a long time.
Claire will be watching it going,
around saying, I remember that.
Heard this first time round.
And actually there isn't much you can do. You've got certain rules that you've got to follow, and then there's a few tweaks that you can do and stuff for more serious, sort of more specialist problems. But actually, it's take milk off to make the next one, and protect your supply and all of those things,
But sessions like this are useful for debunking myths, a bit like
exactly, the right information.
Yeah. So and actually Emma Pickett's been doing quite a lot about people who question what we see as evidence-based practice, and are questioning it and asking mothers to justify what they're doing. We shouldn't have to justify anything. Your choice to feed your baby is your choice. And for however long you want to, it is your choice.
And there aren't any rules. There are a few rules, but actually, you can do what you like with your baby. They don't know any different. No. If you've only had one baby and that's what they get, and one person feeding, so they don't know any other nipples, they don't know any breasts, they don't know, whether they get alternate bottles or breastfeed. They don't know if they get formula and breast milk. They don't know any different. It's what you do for them, and if it works in your family dyad, then that's the right thing for you, and nobody's there to judge you on that one. It's what suits you as a family and what fits in with your family. But there are some consequences for what you do, and if you're happy with that, then that's not a problem. So if you don't stimulate very much, you won't make very much milk. But that works for a lot of people if they're giving formula bottles as well. And so but if you want to breastfeed exclusively and you do that, then that is the rule, is that you've got to take more milk off to make the next feed. So, but if you're happy to mix feed, which is what the majority of women are doing, there's a huge number of women supplementing, and that's their choice to do that. Sometimes it isn't because they haven't got the support they needed, but it doesn't matter if you're happy.
I think we see a skewed view though. I think there'll be a lot of people out there
there are many women exclusively breastfeeding,
like Rachel, who are exclusively breastfeeding, but we just don't see those people because they're not the ones that come to us for help. So we do get a skewed view, but your body is capable of doing it as long as there have no risk factors and you've asked for it.
Yeah, so. But it doesn't matter what you're doing, is what we're trying to say, is that it's what you're happy with that's important. So if you're not happy, then you really got to get help and support. That's the most important thing, and knowing where to get that.
Yeah.
And we're very lucky in Oxford actually, aren't we? Because there is a lot of free support available in the community most of the time. And so people like Oxfordshire Breastfeeding Support, the Abingdon Breastfeeding Cafe, La Leche League, Association of Breastfeeding Mothers have got support.
And the health visitors have got all their baby lunch boxes up and running again now. So there's the baby lunch boxes, so you should get some help there too.
And then there's other sort of private little groups that do breastfeeding that you can go to that don't necessarily charge, but they may charge you if you wanted more one-to-one support. So they do sort of drop-ins where you can go along as well that aren't in Oxford necessarily, in outlying towns around Oxfordshire as well. So but mostly it's free. I mean, the health visitors put lots on, don't they? And the MLUs have got lots of breastfeeding support in the early days. And then there's also, you can self-refer to us as infant feeding, or your health visitor or your midwife can refer to us as well. But you can refer yourself, and that's more important, that you don't have to be asked to ring us. You can just ring us and have a chat with us.
We'll book you into clinic if we think it's appropriate, or we'll signpost you to other services if we think that's the best thing.
Yeah.
Right, Helen has said, hello, this week my 5.5-week-old has become really fussy at feedings. He'll only latch for a few minutes, then pull away shrieking. Will then be calm off for a minute or two and cry again until I put him back on. Then the cycle starts again. I'd say about 3 to 4 hours a day for the last 5 days this cycle has happened. Likely a phase or sound like something bothering him. Is it happening at the same time every day, Helen? Is it maybe in the evenings? Because we often find babies are on off in the evenings.
Have you introduced anything else to your baby? Have you given any bottles occasionally, or introduced a dummy or anything like that? Something that's changed the suckling, the way that they're suckling. I would also look at your positioning and attachment again, just to make sure that that's really good, and book yourself into one of the local breastfeeding support groups just to see if somebody, or get your health visitor to check, to get somebody to check your positioning to see if it's absolutely tip top. And it might be that your baby's mouth's changed shape and it's just not quite on in the same way. And make sure that you use the same principles, move your baby around a bit to fit around their growth, so that they can get onto the breast correctly. And that is lining them up properly. So it's making sure that you line them up nose to nipple still, that they have access.
There's that one.
Thank you. And they have access to the breast leading with the chin first.
And here.
And the nipple just tweaks
past their straight back. Well done, you. Let me have a quick peek. Afternoon, evening, nothing new. Just positioning. Not great now as below comment. I feel he's taking on air now. Okay, so that could be a contribution.
Sometimes if they've got suckling problems, if there's occasionally, if there's a tongue tie problem, occasionally it gets worse between 6 and 8 weeks. So it could be that you've managed okay, but it hasn't been brilliant, and you've managed okay, and then suddenly it's got much worse. So it might be worth somebody looking at your baby's mouth as well if it doesn't improve. Make sure the attachment's really good. Have you started on a contraceptive pill, or have you had an injection or anything like that? Because sometimes that affects your milk production a little bit. Have you just had a period? Sometimes that does affect milk production as well. So
you wouldn't think it would be just one period of the day though, so much.
Yeah.
So just thinking.
I would revisit your attachment.
First and foremost.
That's the first thing, is revisit your positioning and attachment. It might be worth getting somewhere like OBS or the Breastfeeding Cafe to look at your positioning again, to make sure it's really good, and see if there's any room for improvement. We say to everybody every day, there's always room for improvement, even if it looks perfect. So it's not a reflection on you, it's just a bit maybe that your baby's changed.
We're not meant to talk about our own experiences, but I use my own experience when it comes to that, because I fed 2 children. Then with my third, I started training as an NCT breastfeeding counsellor when he was 1, and I changed how I fed him. And I can tell you now, it was so much better. So I'd already fed 2 children, he was my third. So there is always room for improvement. So I could have done with it sooner than that, but anyway, now hopefully we can help those.
Sometimes you just need to tweak it very slightly,
tiny.
And you can't see that yourself, but trained eye might be able to. So, and what, 5.5 weeks?
She's 5.5 weeks, so you're still within our remit as well. So always ring us and we'll fit you into clinic.
Yeah.
So you can give us a call, Helen, if you want to. So we'll have a look.
I hope it sorts itself out if we don't see you.
So she's carried it on, and I didn't see this other bit. So nose to nipples also stop working for a good latch as he gets more active. He actually roots downwards very actively and all tensed up, so hard to get that wide mouth. Any tips to latch an increasingly active baby?
You could do hands off. I don't know if you've done any of the biological nurturing way, which is holding your baby underneath the breast, so they have to lift up to go on, and sometimes they lift up and go onto the breast from underneath, but also you're not putting them on prescriptively, and sometimes they want to be the boss, and allowing them to attach themselves sometimes gives them a little bit more, they become a bit more relaxed about feeding and the fact that they're not being held onto the breast, and some babies object to that getting towards 6 weeks. So it might be that you just change to sort of a hands-off positioning and see if your baby can self-attach, and that might help.
The other thing of doing is I had a mummy in breastfeeding clinic last week, and her baby was about this sort of age, and they didn't like being held in the cross cradle like a newborn, and they actually liked to be in a more upright position with their bottom into the lap. So they sat
big boy feeding.
Big boy feeding or grown up feeding.
Sort of sitting, you could not necessarily cross your leg, but have your leg elevated on a box or something like that, because that sometimes helps. And then you attach them sitting up on your knee, so their bottom is on your opposite knee, and they attach like that, and they're just sort of more upright, and they can see what's going on around a little bit more, because they're just a bit more self-aware once they get to that, and they want to see what's going on and people coming and going a little bit.
So Helen's actually already accessed help. She says you've got a health visit tomorrow. She's going to get her to have a look and have a workshop. She's got a workshop with OBS next week by the Bicester New Mums. I'm hoping that's what it is, when we can fix it. Thank you. So yes, I'm hopeful too.
Yeah, that sounds brilliant. You're doing all the right things, and it's really frustrating when it happens, but it's so subtle that you don't notice that you're doing something slightly different, or your baby's positioning has changed a bit. So it's got to be a positive oral experience for your baby.
She's come back. Great advice. I'll give those a try at a feed where he's cooperating. Yeah, it can be a bit challenging
do it when
sometimes.
They're half asleep sometimes in the night. That's often the first time to do something. They accept it more readily if they're sleepy.
Yeah. Shakira came back to say thank you very much. Charlotte came and congratulated Claire on number 2 baby, so which is lovely. Thank you, Charlotte, for doing that. Tara said, I didn't know this. I thought they had to be frozen straight away. So if I start to keep a few in the fridge, and as it comes to it, I'll slowly freeze away. But when the time comes, I'll have a couple in the fridge to bring with me. Thank you so much. Absolutely, spot on. Do that. Don't, you can leave them in the fridge. We say you can go in the fridge for 5 days and then into the freezer. So keep some fresh. That lasts longer. Once it's frozen, it has shorter lasting properties. So you can do a rolling thing, as you get closer.
And if you're in early labour at home, just do some hand expressing, and then it's fresh, and you've got 5 days to have your baby then, haven't you?
Yeah, perfect.
There's no pressure at all then.
Shakira says, sorry, Megan, is it okay to combination feed? Well, that's totally your choice, Shakira. Obviously, in an ideal world, babies are exclusively breastfed because that gives babies the best health outcomes for their long-term health. We know that breast milk is the food that is absolutely spot on, tailor-made, bespoke for your baby, and it will constantly, and Naomi mentioned it earlier, it's constantly changing. From the moment that you have your baby, it's constantly changing to meet your baby's needs. Your body knows how old your baby is, and it's changing what's appearing in the milk to support your baby's optimal growth. However, some mothers either have to start giving formula milk because they haven't been able to establish a good enough milk supply, or big enough
work,
or they have other reasons for doing it. Some mothers who go to work might choose to express, but there are many reasons why some people would end up combination feeding, or they may go into it thinking that's what I want to do from the beginning. We would highly recommend
to feed your baby, and that's a big reason why a lot of mums do it, is they want a partner to help.
And the other way around that is to express. So many mums find they have more milk in the mornings, so that they, would express off enough milk for a partner to give in the evening, so the baby can remain exclusively breastfed. But
There's a lot of other things that partners can do, isn't there?
Yeah,
like
absolutely.
make cups of tea and
look after you,
and
you know, and I know people say, well, nappy
and
changes aren't fun. They're not. Like, they are. They're a great time of interaction. You've got the baby at absolutely the right height for a conversation, you know, and you can have a conversation with a newborn baby. You take time and chat to them, wait a little while, they respond. So it's absolutely amazing. So, you know, changing a nappy is not a bad thing, it's a wonderful thing. It's a great time for that communication.
And they may notice things on your baby that you don't notice because you're just feeding and, you know, have them close, and they may notice things going on the baby that you haven't seen. So it's, you know, it's sharing.
So if people are going into it thinking, I want to combination feed in the long run, we would highly recommend to spend the first couple of weeks establishing their milk supply first before they start introducing anything else. Because if you introduce other milks early on, then the milk supply will be inhibited, and you won't have that choice. So it's better to have a milk supply established and then start introducing other milk after a couple of weeks.
If you don't ask, it won't do in the early days. So, you know, it's that the clock starts ticking at birth, and you've got a couple of weeks in that window to make the milk. And if you don't do the stimulations in that time, and the further you are away from your baby's birthday, the harder it is to make milk. So the more you do stimulations nearer to the birth, the easier it is to make milk and catch up. So if you leave it till 2 weeks, you're really going to work very, very hard to make milk. Whereas if you do it in three days from the birth, or the day after, you're going to get that order in early, and your body will catch up very quickly and make milk. So, you know, understanding that.
Rachel's responded to this as well. She says, and partners can do skin to skin too, which is true, because that's absolutely fabulous. It's great for regulating baby's heart rate, temperature, breathing.
Holding them down.
Yeah, they conserve energy. They use less energy when they're skin to skin, because all of those, you know, regulations are happening without too much, you know, problems to the baby. So that's a lovely answer. Scooting back because we're going all over the place. So that was Shikaya saying about the combination feeding. So it's totally your choice, although in an ideal world, all babies would be exclusively breastfed.
And, you know, it's got to be from you as a family, not from aunts and uncles and friends and, you know, other family members that want to get involved and are desperate to feed your baby. Because actually, you know, we talk about if you're giving babies bottles, that you've only got a couple of feeders. And so that's usually a mother and a partner, or a mother and another family member, if, you know, you haven't got anyone to help you. But you're not passing the baby around the room and somebody different, your neighbour's coming in and feeding your baby, and then somebody else is coming in. You know, they need to know who's feeding them, and that's part of their development and their security. So, you know, if you're being pressurised from family members that they want to help you, they can do lots of other things instead of feeding the baby, and they can help you afterwards.
This links with another comment that Rachel's made. She said, I think OMVP shared something recently about how partners can bond without feeding, like skin to skin. So have a look on the OMVP Facebook page and see what they've been suggesting.
But you know, if you want to, that's absolutely fine. If you want to do it, that's absolutely fine. But to understand why you want to do it, is it for the right reasons? Is it because that suits you yourself? Or is it because you're being pressurised from other people so they can help you and feed the baby instead? And that's not what we do recommend, is that you do the feeding, or someone directly close to you is.
I think anybody on this forum who have breastfed before and have managed to do it will tell you that actually in the long run breastfeeding is easier than offering formula bottles, because they need to be made up. Mums who breastfeed do tend to get about 45 minutes more sleep a night, amazingly enough. Who'd have thought? Because they're not having to get up and make a bottle, cool it down and then feed the baby. Whereas, you know, if they've got a baby that they're breastfeeding, they can just bring them in, feed them, pop them back, and then actually they'll get more sleep that way, and the hormones are released to help them to go back to sleep. So there's lots of reasons. Charlotte has made a point that's very, very valid to all of this. I had to do both breastfeed and formula feed as I didn't have enough milk, and that's one of the main reasons we find mothers do end up combination feeding, and that's because they've struggled to get their milk supply up. But as Naomi has just said, those early days into the first 2 weeks are crucial for establishing your milk supply. If you've done it then, you shouldn't have any problems later.
And we know from all the things we observe that you know, if you have less skin to skin in the first hour, your milk production is at risk. You're vulnerable in your milk production. So, you know, it's really important if you have a cesarean that you get your baby skin to skin in the first hour. and that's hard when you're feeling shaky and cold and sick, and you're on your back flat and someone's rummaging around in your tummy. It's really hard for you to be positive about skin to skin, but actually you know, your partner can do skin to skin, but it's not going to stimulate your hormones. So it's really important that in that first hour or two you do that skin to skin and you get your baby fed in the first hour, because nearly every person that comes back with their baby for weight loss has had some sort of interventionist delivery. So they may have had a cesarean, they may have had a forceps delivery, they may have had heavier blood loss, and it's where people have had to deal with things in the labour room in the first hour, which has interrupted that skin to skin. And so you know, first feed and the first skin to skin and or hand express in that first hour is going to massively impact your milk production in 3 or 4 days time. And you know, the clock ticks all that time, the clock's ticking, so it puts a lot of pressure on you. You might feel very pressured, but actually your baby is expecting to be skin to skin on your tummy or your chest, under your chin, when you've had your baby. That's where they expect to be. And all the things that Alex said about it, calming and keeping them warm and priming them to do all the things they should do, is really important. And you know, that should be in the first hour if you can, or as close to the first hour as you can make it. So if your baby's separated from you, then do it as soon as you can after you've got the baby with you. Or if you're not feeling well, as soon as you do feel well enough to do it.
Right, well, we've whipped through all of those now. I've gone backwards and forwards, and I've just gone back and checked and hoped I haven't missed anyone's question. So if I've missed a question, which I have on occasions, please just give me a prompt and I'll go back and look. But I think, because I was going backwards and forwards a little bit, because there were things that were relevant, but I think I have covered everybody so far. So it's 17 minutes past 3.
We've got a little bit of time left.
We've got a new one.
Oh, lovely.
So, lovely. Chiara said, 10-week-old's been waking up at 3 a.m. every morning, cluster feeding until 8 a.m. with only 20 minutes sleep in between feeds. Let's shoot back up again because it's skipped down. 20 minutes sleep in between feeds, and she'll only take very small feeds. She tends to fall asleep on the breast, so alternate giving her a bottle of express milk and the breast, or offering the breast first and then topping up with the express milk. Is it normal that she's feeding every 20 to 40 minutes in those early hours of the morning, and should I be sticking to either offering the breast or the bottle?
Is that the only time she is unsettled at that time? Is that her chat time? Because sometimes babies do it between 4 and midnight, or 8 and midnight, and some babies do it between 10 and 2 a.m. and some babies do it in the middle of the night in the early days. But at 10 weeks I wouldn't think that she should be doing that still.
So I was just thinking about my middle one, who was a terror, and she's still a terror for not going to sleep, so she would not go to sleep. I mean, is she growing appropriately, Chiara? Is she gaining weight appropriately? Is she pooing and weeing appropriate to her age? You know, have we got any concerns about her? Is she maybe not just wanting, are you putting her down in a cot at the end of the feed, and is that what's going on there? Oh, you skipped back up again. Let me have a look. You've given me an answer. She used to do it early evening, but it's now switched to early morning. So
I know one of my babies did it between 2 a.m. and 5 a.m. for about 8 weeks. First 8 weeks, and then they started to behave a little bit, but that was their chat time, and I remember very strongly about being in the middle of the night. I think that there's always room for attachment improvement, so it might be worth getting the attachment looked at again, just to make sure that it's really good. You know, sometimes your supply goes down a little bit, so you've got less volume but more fat in your milk, and that you know, maybe they're looking for more fat and stepping it up. Is it the last 2 weeks she's been doing it?
Let me have a look. Breastfeeding. I'm not saying quite how. Oh, I think you said at the bottom, didn't you? We used to do it early evening, now it's switched to early morning, so I don't know how long it's been going on.
They should be more settled by 10 weeks, but they should be still waking at night. And, you know, is she wet and dirty? Are you changing her name?
We have got another message from Chiara here. She says, yes, no concerns about weight or anything. She definitely does not like being put back down in her crib. It could be that. They don't. And, you know, if she's slightly more awake, and you're, because she's in her chat time, and you're putting her down, that could be quite possibly that. you know, that she's not wanting to go down. I mean, you could try popping her in with a t-shirt that smells of you, one you've worn, you know,
put a hot water bottle in the cot and then take it away once she's in, you know, so that it's really warm.
I used to use a hairdryer. I used to have the hairdryer by the cot and heat the cot up before I put the baby in, so it was warm when they went in it. Because you have to go and fill a hot water bottle. I had my third one in the Netherlands, and that's what they did. They said you had to have a hot water bottle, and I said, well, no, thank you. I'll use my hairdryer because you can heat it up.
Something to warm the cot, shall we say?
Yeah.
Just so that they don't notice the transition from you so much.
Or go and have a good look at the Lullaby Trust and minimising the risk of having a baby in your bed. So, you know, we know that the safest place for a baby to sleep is in a cot in the parent's bedroom for the first 6 months. However, we also know that many babies will not settle separated from parents. So the Lullaby Trust has some
exhausted from, you know, not sleeping.
And the Lullaby Trust have some really good resources that talk about how to minimise the risk. So Lullaby Trust is a very good place to look, and BASIS, which is the Baby Advisory Sleep Information Service, BASIS it's called. So those two places, if you go and have a look and see whether anything like that would work for you, because often it is babies do not want to be put down. We always say babies are born not knowing whether they are humans, chimpanzees or gorillas, and no other primate.
Expect to be close to you as a parent.
No other primate it gets put down in the first 2 years of life.
Yeah. So, you know, it's really tough one, that one. And, you know, I think most parents are terrified of you know, anything happening to their babies. So they, you know, they don't want to put the baby in any risk at all. So following the rules is really important. But, you know, that's very good to have that support. And you also need to have your sleep. You know, it's very difficult to function from 3 a.m. every morning. That's really hard when you've got a baby.
Yeah.
So it's important that you have sleep as well. Does she go down at 8 o'clock and then go to sleep? Can you sort of go to sleep a little bit in the morning as well, so you can get through the day all right? It's very hard, and it's getting light at 4 a.m. now, isn't it? So babies are very sensitive to that light. If you know, got light coming through and the birds start making noises, and I remember very vividly, you know, being very sensitive to a rookery behind my house and the noise that they used to make. So I used to be paranoid about that. You know, babies are very sensitive sometimes to sleep, and as Alex said, she had one that didn't sleep. I've got one that still doesn't sleep at 30. You know, so they're born to sleep or they don't. You know, but it's just who they are sometimes, and they don't like missing out. But you know, you should be able to get some settlement, and it's not forever. They will go through that, and then they'll do something different.
As you've said, it's already changed because she was feeding early evening, and now you've got this going on. So it does keep changing. So hopefully this will pass.
You're not drinking lots of coffee in the evenings or anything, are you? Sometimes babies are very sensitive to caffeine, and we say you can eat and drink whatever you like, but you know, I'm very sensitive to caffeine, and I couldn't have caffeine when I was feeding my babies because it was very sensitive for them. And so it's usually quite a long time after you've had it that it goes through the breast milk. So if you're having a cup of coffee or something before bed, or a strong cup of tea, sometimes that affects the caffeine a bit later on in your breast milk. So, you know, have a little think, and you know, you can eat and drink whatever you want, or if you're drinking things like Coke or you know, any drinks that might have got caffeine in them, it might be that your baby's very sensitive to caffeine. If you're very sensitive to caffeine, it's normally if you're sensitive to something that, and you probably wouldn't be drinking it late in the evening, but generally just have a think about what you're having earlier in the evening that might stimulate your baby to be awake.
Kara's come back. Thank you. I'll have a look at those websites. Yes, she started sleeping from 9 p.m. through to 3 a.m. in the past week or so, which was when the 3 a.m. waking and cluster feeding started. So a dream feed.
Yeah, I was just going to say, can you do a dream feed about 11 o'clock?
Yeah, 11 o'clock, pick her up, feed her. Remember, responsive feeding means you can choose to feed your baby. Responsive is reciprocal, it goes two ways. So you can pick your baby up and feed them because you're full. You can pick them up and feed them because you'd like not to be woken at 3 a.m. or not so much.
They can wake you up when they're hungry.
Yeah, or you can pick your baby up and feed them because you're feeling a bit lonely, like a bit of an oxytocin rush. So remember that feeding is responsive for mother and baby. It's not just one way.
It's two-way.
Right, hopefully that's how I've seen questions flying in backwards and forwards, so I'm going to quickly go back in. because that was there. Right, so that was Kiara's question, and we skipped down to the little one a bit below. So Charlotte has said, if and when I have another baby, would that happen again, or would it be different? Also, would a ventouse delivery stop me having a water birth? I don't think a ventouse delivery per se would stop you having a water birth.
No.
Depending on the reason.
No, absolutely not. I mean, if your baby got stuck or something, you know, if there was a problem at the birth other than just needing a ventouse, that might affect it. But other than that, no.
With regard to your milk supply, then we would be thinking about ensuring that you do as much as you can to establish it in the first few days, as Naomi's been talking. So we can talk to you about that even before you've had your baby, if that was the problem. So, you know,
Charlotte, in place for you.
So Charlotte, you know, when you are expecting number 2, you could ask for an appointment with us. It's a telephone appointment, and we would talk through what happened last time and what we can suggest that you do that will help it this time. So we do lots of those,
But you know, no milk supply with your first doesn't mean no milk supply with your second, unless it's a physical problem that you've got. So it's often the circumstances around the birth, which is what I talked about earlier, which is the skin to skin and the early stimulations, and the circumstances at that birth. And this is another baby that you have. You know, you've got to just put everything in place to make the milk this time when you have the next baby.
Okay. Elisa said, hi, I'm 33 plus 4, and am I allowed to start collecting colostrum next week? Ooh, 37 please, not before 37, Elise.
You don't want you to go into labour.
Yeah, so as we signposted earlier on, have a look on our website. If you go on to do a Google search for OUH maternity feeding, you'll find a link to a leaflet about collecting colostrum when you're pregnant, and links to videos, and one of them is hand expressing. So have a look at those. Right. Rachel's come back. Can I ask about feeding and sleep patterns? Her nighttime sleep window is 12:30 a.m. to 10:30, obviously with waking for feeds, etc. I'm just rolling with it, as I imagine she'll start to go to sleep earlier at some point. Not sleep training or anything, just responding to her. Do I need to? Is there any more of this? Do I need to do anything about that? I'm just going with it.
12:30 till 10 a.m.
But no, with sleep feeds in the meantime. She said with feeds.
Okay.
Waking for feeds. Well, if it works for you, don't worry about it.
She will get tired a little bit later on. Is she 3 months old? Is Rachel's the little one 3 months old? Is that a different Rachel?
No, we've only had Rachel. Yeah, I think she was
12 weeks, wasn't she? And she was unsettled.
Yeah, I'm just going back. Rachel.
You know, she won't be long before she starts bringing her evenings a little bit. You know, you won't be able to keep her awake.
12 weeks, yeah.
You won't be able to keep her awake in the evenings quite often, so that her eyes will be closing before that. And I think probably from about 16 weeks, 20 weeks, you start sort of doing regular baths. And I mean, some people do it before, but you know, having a routine before bath, sometimes that you know, they're ready for bed. And I'm sure many of you know that you know, that bewitching hour from about 5 p.m. where they're really challenging at times, because they're so tired, and you don't want them to go to bed at 4:30, 5 o'clock. You want them to go to bed at 7. You sort of keep them going for a couple of hours, and you'll get to that phase.
And obviously bedtimes are totally and utterly up to you.
You work all day, you want your babies awake in the evening.
Yeah, I can remember going, I'm half Portuguese, going to Portugal with my children who were brought up in the UK, and they were amazed that kids were all running around in the holidays until midnight, and that's quite normal. Babies, they go to bed late and they get up late, so that was completely normal. So it's very much up to you. If it works for you, that's not a problem. Yeah. So you know, it's whatever works for you as your family. So Rachel's written, Poppy would love baby classes between 8 p.m. and midnight. Oxford needs a baby rave.
It's a party animal.
I'll tell you what they end up like, because I've got one. That's exactly what mine was like, and she's still a party animal.
That would be fun.
Yeah, absolutely. It was the big screen, wasn't it? You could go to the cinema with the babies. I missed out on that totally. I love that. The idea you could go.
Cinema Bambino, they do that in Chippy.
Yeah. There used to be the one here in Oxford, and it was called the Big Scream. So you could go with the child, and it didn't matter if they cried. So you could all go with your babies. It didn't matter.
Yeah.
Kiara's come back. Yes, good call on the dream feeding. Thank you. That might really help.
Might just regulate her clock a bit.
Elise come back. Okies, thank you. I only asked as I attended an online antenatal class. As was told I could from 34, so I wanted to check. I'm glad I did. Thank you. Okay. Was that provided by one of our midwives? I wonder who was saying that, because we would really highly recommend you don't do it till 37 for that reason. So
we don't want you to go into labour.
Much as the risk is small, we don't really want you to. So, yeah, Rachel came back and confirmed her baby was 3 months.
Yes, I thought so.
But 12 weeks. Wow, that was brilliant. We've gone all over the place with those questions, and I think I've covered them all.
Lots of great ones.
Yeah, brilliant.
Time up.
Elise, I think perhaps it might be worth just if you are friendly with the other people that were on that antenatal class, just say that the recommendation from the infant feeding team is 37 weeks, because much as that risk is small, we don't really want people putting themselves at risk of having an early baby early. No, it's a well-known person online who does them. I don't want to name drop. Okay, all right. Maybe you can feed back to them and go, that's not what I'm hearing. So, don't know.
Not recommended.
I don't know how you feel about putting your head above the parapet on that one. No, she definitely
Just
will. Well done.
Just say you've had conflicting advice and you want to clarify.
Yeah, absolutely. So, brilliant. She's going to do it. Well done, you. Right, I think we're done today. So we're here next week. There's no reason we're not here next week, is there? No, we're here. Here next week. We'll be having a few days off in June though, because we've got some holiday coming up. So. But we'll be around nearly all of July and August though, won't we? Because we've got no...
We're mostly here, aren't we, when we can be.
Yeah. Right, well thank you very, very much all of you for your fab questions.
We'll talk about reducing
we
production.
didn't get to that.
We'll talk about that next week, shall we? We'll start with that if the questions are slow coming in.
Yeah.
But we want everybody to get their questions answered rather than us blabbing on, which is what we can talk for England.
Yeah.
So we'll go back to that next week. So if we don't, remind us, because some of you might well want to know about suppressing your milk supply a little bit, or weaning off and stopping breastfeeding, because everybody comes to a time when it happens, and they want to be sure they're doing it right. So we'll talk about that next week.
Anyway, thank you very much, and
have a good week.
See you next week.
And have a good week. Think of all those questions for us. Bye from us.
Bye.